Signs you may have endometriosis. Endometriosis is a very difficult diagnosis to get, and truthfully, the bulk of women will suffer for many, many years before a diagnosis is given. One study showed that it was on average 7.5 years before a woman actually got the diagnosis that she needed. Oftentimes, the diagnosis is missed for women because we enter the doctor's office in our teens when we first get our cycle and we are having really painful periods and really heavy periods, and we are immediately put on the birth control pill. Now, yes, the birth control pill has its time and place, especially when we are talking about its use for contraception. When we're put on the pill, we are no longer getting an actual period, we're getting a bleed, meaning that those symptoms of heavy and painful periods are no longer present and women think that things have been corrected. So naturally, we don't get any of those symptoms again until we're much later in life and we decide to come off the pill or off an IUD. And for a lot of women, that's right before they're ready to start trying to have kids. Here are some of the common symptoms of endometriosis to help determine whether or not this may be a diagnosis that's applicable to you. The first is painful periods, and this does not just mean pain on the first day or heavy cramping on the first day of your period. It can actually be pain up to 1 to 2 weeks before your first day of flow. That gets coupled with cramping that is very debilitating for some women. A lot of women will have to miss school, events, work because they are just in so much pain and will often have to take naproxen or some type of over-the-counter medication to help alleviate those cramps so that they can just function on a normal day-to-day basis. The next thing are heavy periods. So we are not talking about changing a tampon 3 or 4 times a day. We're talking about super tampons that can be saturated every 1 to 2 hours. Pain with intercourse is another really common symptom for women who have endometriosis, and this is not pain at the opening. This would be a pain that would be classified as much further or deep up inside. Some women will experience pain with bowel movements or pain with urination, and this really just depends on where the endometrial lesions are within the abdomen. Chronic pelvic pain, which again does not have to be directly correlated to right when you actually have your period. It can be present for some women all of the time. Bloating and nausea can be 2 other common symptoms linked with endometriosis. Fatigue can be another common one just because of all of the inflammation and systemic inflammation that's happening in their body. The last thing, of course, is fertility, as it can negatively impact your fertility health. If you want to learn more on how I can help, please don't hesitate to reach out.